So this is Mark Lacuna. He is a physical therapist in the Azusa area, and I'm going to ask you a couple questions today. Just appreciate your time, first off, for being here, and let's get to it.
Welcome. All right.
All right, so the first question I have, do you feel like you're in a position where you can always learn?
Yes, I'm in a position where learning comes natural. When treating patients, I'm learning a lot about the patient's story, and the patient's story helps me determine the appropriate intervention for them. I'm also learning a lot about the injury in the process. Learning about the injury lets me better understand how to treat it the next time with other patients that have the similar conditions.
Nice. How physical is your job, and how do you stay in shape?
First of all, as a physical therapist, the job requires a lot of standing and walking around for long periods of time. Physically, the job requires carrying various sized equipment, so you can go from Bosu balls to dumbbells, depending on what the patient needs. I stay in shape by keeping up with my regimen of running an hour a day. Usually, sometimes I find myself running every other day, depending how tired I am based on my job and how life happens, because sometimes life happens.
Yeah, for sure.
And running every other day lets me keep up with my endurance so that I can stand and walk for long periods of time.
For sure. All right. How would you describe your connection with your patients?
I would describe my connection with my patients as a symbiotic one. What I mean by that is I consider it as a symbiotic relationship because both the patient and I benefit from our interaction with each other. We both benefit because patients get treated back to full recovery, and I get to learn about the treatment plan so that the next time I have another patient with the same condition, I can help them with their functional movement and have a better idea of how to get them through the process quicker and efficiently.
What would be the most stressful part of your job?
Oh, the most stressful part about the job is charting. Charting requires time so that the information that you're recording is actually correct, and also, pretty much correct. Because if there's incorrect information being jotted down on the charts, the treatment plan won't go as planned, and usually the recovery period takes longer.
It just messes everything up.
Yeah.
And stuff. Yeah, I getcha. How do you maintain a social life outside of work?
Social life, it gets harder once you get into the job, but it's all about timing and management. So I maintain my social life outside of work by going on hikes, marathons, and social gatherings with friends and family. So I try and get involved here and there with that. I also get involved with my church, which lets me interact with close friends who have the same beliefs so that I can then incorporate that into my work.
Very nice. Do you feel like you have a good balance between your work time and home time, or is there a little bit of a difficulty in that?
In the beginning, there was some difficulty finding the right balance between the two, but once you find that sweet spot between the two, then it gets a little easier. I found the balance between the two by prioritizing. It's all about prioritizing your time because it can get overwhelming at times.
I bet. Yeah.
But once you get that mindset of prioritizing everything, it gets a little easier.
That's good. That's good. Are you financially stable with this profession?
I'd say this profession, yes, it provides stability because financially, it's hard to find jobs in the workforce. But with physical therapy, you're actually having a higher chance of getting a job because there are a lot of patients who are injured from their work, just even natural complications. So just like being able to walk, patients find themselves getting injured through their work. So yeah, financially it is stable.
Okay, that's good. What kind of ethics and morals do you apply at your work or office?
Okay, so with ethics and morals at work, it's always good to remember that not all people that you're treating with or getting interaction with have the same beliefs. So when I'm at work, I try to do my best to keep my religion to myself, but at the same time, I do pray for my patients' recovery, and I keep that to myself, knowing that I think prayer helps with the recovery process. When I interact with my patients, I try to incorporate my beliefs as much as possible, but also following the standards and protocol of the hospital that I work at.
Makes sense. I like it. What kind of people do you interact with, and do you meet many different types of people? Is it like a kind of consensus?
No, it varies. As a physical therapist, you're treating everybody from people who are having low back pain to those who have who needs rehab because they either had a stroke or a heart attack. So overall, you're treating various patients from different ethnicities to different race. You get involved with a whole lot of patients. So chronically, there are a lot of patients who need different types of intervention, but you gotta follow the guidelines based on their condition.
And lastly, what hobbies do you partake in outside of work?
Outside of work, I play basketball on an intramural team for a league. So that keeps up with my cardio and stuff.
Keeps you in shape.
Yeah,
and
it keeps
stuff.
me in
That's
shape
good.
for work. But I also enjoy that because that's my passion. I like to play basketball.
That's good.
And I also try to go on hikes and finding some time with myself by either praying or watching TV and playing video games, which I don't have as much time anymore, but I try to find time for that because you need to sometimes limit your time to yourself because it gets difficult as you start working.
Yeah, as you start working more, it definitely can get a lot harder.
Yeah.
Well, yeah, thank you for the interview. It means
You're
a lot.
welcome.
All right.
Thank you.
Thank you.